And today, very happy to have with us in the studio Dr. Violet Hoon. Welcome. She is the head of Cardiac Rehabilitation Services at Tan Tock Seng Hospital. Hello there.
Hello. Hi. Thanks for having me here.
Okay, we're going to be talking about the benefit of cardiac rehabilitation for those with advanced cardiac failures and issues. So before we get into the actual rehab, which I really want to talk about, there's so much I want to find out about. Can you explain to us what advanced cardiac failures or advanced cardiac issues are?
Okay. So basically, heart failure is a clinical syndrome that we diagnose when patients have breathlessness on exertion, when they need to take certain medications, or the cardiac investigations show that their heart is weak or not working as well as you and I are sitting here today. So for heart failure, it's continuation. So they can start from stage A, stage B, stage C, and then stage D. Wow. So when they start to develop more symptoms, they start to have symptoms that affect their daily activities of living. They start to have requirements for higher doses of medications. They start to develop worsening symptoms. That's when they are progressing to advanced heart failure.
Okay. So these are not patients who have had, let's say, a heart attack. Can it be?
Yeah, it can be. So heart failure essentially can develop in patients who have had a heart attack,
right? Who
have had other muscular genetic conditions.
I see.
So anyone with any known cardiac conditions can develop heart failure if you live long enough.
If you live long enough.
Yes.
Yeah.
Okay.
Yeah. Okay, so this was interesting because there was a trial that went on for a year, right?
Yes. Yeah.
And then the full-fledged program. What was the key motivation behind this HF Care program? HF stands for heart failure,
yes,
right?
Yeah.
How did you identify the gap that it needed to fill?
So when we were looking at our cardiac rehab program, we have cardiac rehab for patients who have had a heart attack, who have had stents. So they would be recommended to come back. But I noticed that there wasn't a dedicated program for patients with heart failure. And in addition, for elderly patients who actually would benefit from cardiac rehab, there wasn't one either.
Okay.
And lastly, for patients with heart failure and who are elderly, they're actually shown to require more emotional, more psychosocial support, and a more dedicated, personalized program to help them get better.
Because that's interesting that you say that, because I've had a stent put in, and I remember when I was going through rehab, there were elderly people I met who were going, I don't know why I got to do this. I'm old. I've already got an advanced heart problem. I shouldn't be exercising. Why are they making me exercise?
Yeah, so essentially, it's like a myth, right? So they think that, I'm already breathless. Why are you making me breathless?
Yes.
Right. So it's a continuum. So when you have heart failure, your sentinel symptom is you feel breathless. So what do? You stop moving.
Yeah.
And what happens to your muscles? Your muscles starts to atrophy. They start to be less efficient in using oxygen. You start to not want to walk so much, and then you get even more breathless. Right. Yeah. So then that also affects your vessels, your muscles, your lungs. They get less inefficient. So what happened in the end is you get more and more breathless. Whereas when you do exercise therapy, when you do cardiac rehab, it actually works on all systems. It doesn't only help the heart. It helps your muscles, it helps your lung condition, it helps your vessels be more efficient.
Right.
So it's a multi-system benefit.
Okay, the program actually has shown to reduce your body fat by 11%.
Yes.
And also 8% increase in muscle mass, right? So that is amazing. We're going to talk more on Facebook. Join us there.
See, so it's amazing the number of people out there who think, I'm elderly, I should not be doing anything.
My heart is weak.
I should be resting, which is probably the worst thing you could do.
Yes, definitely.
So this HF Care program, right? There's medical, there's physical, psychological support. Can you maybe walk us through the various aspects, like, how do you craft a program for a patient?
Yeah. So essentially, cardiac rehab should consist of three main components anyway. So you have exercise therapy, you have education and control of risk factors, and lastly, mood and psychosocial support. So when patients come to see us, they actually get to see me. And one of my cardiology colleagues, they get to see the nurse and they get to see the physiotherapist. And we do many types of assessments. So medically, I would definitely look at medicines. Is there anything else I can adjust? Because heart failure requires many pillars of medications to help your condition get better. We want to make sure that the patient understands the condition, all right? And the nurses do the education. They do some form of quality of life assessment. They do a form of a mood and anxiety review. Are you having any stress? Do you have some anxiety that we can help with? And lastly, physiotherapists would look at the patient's usual exercise tolerance. We do a very short test to see where he stands, where the patient stands, and then we give some advice and prescription.
What is this 6-minute walk test that you guys do?
Excellent. So you can think of it as a stress test, but it's a sub-maximal stress test. That is a very simple test that we make patients walk laps over 6 minutes.
I see.
And the distance that you cover in that 6 minutes tells us what is your current fitness level. So for heart failure patients, if their 6-minute walk test distance is less than 300 meters, it means that they don't have a very good prognosis in the next few years. So therefore, when patients come, let's say 200 meters after the program, if they improve more than 31 to 40 meters, that's a significant improvement. Then we want to look at that. For our program, our patients actually improve an average of 77 meters. So that's twice the significant distance. So the more the merrier.
Right.
Okay. From conducting a study on these 100 patients so far, what kind of improvements have patients typically seen? I mean, we talked about body fat, muscle mass, and all that, but psychologically, I mean, aside from physical sense.
So we do an assessment called an EQ5D. It actually looks at 5 aspects, including your self-care, your pain management, your discomfort level, your mood. And it's shown that there's a 50% improvement. So that is one of the assessments that we had done for our patients. And they actually enjoy coming back. So we build a rapport. Because the elderly patients, if you give them a prescription, give them a phone, there's no human interaction. It's very difficult for them to want to come. So my patients come back because, I'm seeing you this week. I didn't see you last week. So they would be like, have a rapport with the team, with the nurses, with the physios, with myself, and they are excited to come back for exercise.
So the program is 12 sessions. Each session is 1.5 hours, right? Outside of this, can they do the same thing, on their own? Yes.
So because of the frequency of the program is a bit limited, but what we advise is in between the sessions, they are given a prescription. They're giving home advice on what to do. For example, we'll advise them to get a pedal bike at home, and then we'll say, okay, during the days that you are not coming here, you do pedal bike 3 times a day for 10 minutes while you're watching TV. So that strengthens your lower limb muscles and helps with vessels and blood flow. So they actually follow. And for patients who follow that, they actually improve within 2 sessions or 3 sessions because they've done it at home with their own efforts.
So they're actually doing this more like 4 times a week.
Yes, correct.
5 times a week.
Ideally, it should be 5 times a week.
So with the higher rates of heart failure, particularly in Singapore compared to the West, what are the underlying factors, and how does a program like your HF Care, how does that address this?
So the reason why heart failure is more prominent in Singapore and in fact Asia and Southeast Asian countries is because we have a higher incidence of risk factors like diabetes, hypertension, hyperlipidemia.
What's hyperlipidemia?
Sorry, high cholesterol.
High cholesterol.
Right.
So then patients tend to get heart disease after that.
So then it's a mixture of all these different conditions.
Yes, correct.
Right?
So that's why it's higher in incidence. So I think HF Care would address. So HF Care not only manages patients with advanced heart failure. We also take patients with early stages of heart failure, but we may not take them through the whole program. So I think at the start, we want to build awareness. We want to educate the patients and their family, and we want to ensure that they're aware that this program exists so they can actually come back to us anytime they need to.
With Singapore's rapidly aging population, right, how do you see TTSH scaling up HF Care to meet the rising demand in the next few years?
So TTSH manages a lot of elderly patients, and that's our forte. So we intend to upskill our allied health and our nurses. We will expand the program within the hospital, but it not only stops with us. It has to be an expansion in the community and collaborate with all our community partners, day rehab centers, and we want to educate and train them to also help manage the rest of our heart failure patients in the community.
So can anyone, let's say if a listener is listening in and they've got elderly folks, who have heart problems or have had heart failure, can they just go walk into TTSH and look for you?
So, well, if they have their own doctor, they could ask their doctor for advice. There's a potential that you could refer to us.
Right.
But there are other programs too, although I think the Tan Tock Seng Heart Failure Program, it's probably, HF Care is a very dedicated program. So just get a referral, get some advice from your own doctor before you embark on any program.
We've got a question coming through on our Facebook that asks if it's harmful for people with heart problems when they go through not rehab with you guys, but when they're doing it at home and they start to shoot past their normal heart rates. How do they know how far they should go before they start to pull back?
Excellent question. So before they start, they should seek a healthcare professional advice and prescription. Based on that, we would actually tell you, you only can hit your heart rate of 140.
Yeah.
Once you hit 140 and it goes above, just stop. Stop and rest. If you do get symptoms, seek advice from your trusted healthcare professional, and then they can advise you whether is it something that needs to be investigated further, or is that just a limit that you need to keep to.
Okay. The other thing, and it's very interesting, people always ask me this because I've had a heart attack. So I'd like to hear it from a professional. Yes, heart failure, breathlessness, definitely. Are there other symptoms a lay person can look for to know that they are about to have heart failure or a heart attack? We'll deal with that when we go back on air.
Yeah. That's out to Sugar Ray right here on 1FM 91.3. It's the Morning Drive with Flying Dutchman and Carrie Chong. And here with us in the studio, once again, welcome Dr. Violet Hoon from Tan Tock Seng Hospital. She's the head of Cardiac Rehab Services. So we were just talking, FD had a question for Dr. Hoon.
So people ask me this, and I can only give them my personal experience. Yes, heart failure, heart attack, breathlessness is one thing you look for. Are there other things people should look for that would signal them that they're about to have a bout? You know what I mean? What should they look for? I remember when I had it, it started with chest pains. I ended up getting pain in my jaw.
Oh, wow.
Yeah.
So it spread to my jaw, my neck, my jaw.
It's a symptom of heart attack, heart ischemia to the heart.
So
Okay,
those were some of the things I felt. But what should people be looking for?
So the most common symptoms of heart failure or worsening heart failure can be related to, number one, breathlessness. Number two, you notice yourself not being able to walk as long as the distance as before. So decrease in effort tolerance. So probably you used to be able to walk 100 meters. Now you can only walk 50 meters and you need to rest. Other than that, there are symptoms that indicate heart failure whereby you get fluid accumulation. So you can have leg swelling. You can have breathlessness when you lie flat. You need to use more than one pillow to sleep. That's what we call autopnea.
Wow.
And you wake up in the middle of the night feeling breathless. Other symptoms could be that you feel your heart beating very fast. It's just running all over the place. Other more serious symptoms include having a loss of appetite, losing weight despite not controlling your diet. So these are the more advanced symptoms. But what I mentioned earlier are the more common symptoms that indicate patients are getting into worsening heart failure.
Yeah, wow. My brother-in-law, I actually found out he was suffering from a heart attack because he was wearing a tracker, a fitness tracker. And I think he was aware because he had like irregular heartbeats and he was checking his tracker and he drove himself to the hospital.
Oh.
Yeah. So
Yes.
would wearing a fitness tracker help in any way? And what should you look for?
Okay, I'm not going to advocate for a fitness tracker per se, but personally I find it useful. HPB provides us with the step counter. I think it's very helpful to monitor your symptoms, your vitals. So, for example, if you have high blood pressure, if you have other medical conditions, it's always helpful to kind of monitor your own.
So it's a general guide. It's not a Bible.
Yes, it's not a Bible. But it's good to know because sometimes you do detect things like what your brother-in-law had detected.
Okay, so finally, what advice would you give to caretakers or family members of elderly heart failure patients who might be hesitant about going for rehab?
So I think first of all, speak to your usual doctor, speak to a healthcare professional to get advice on whether patient is a suitable candidate. Number two, I think that any form of activity is helpful. They don't have to go running a marathon. They don't have to climb 10 flights of stairs. They just have to walk more, take your steps as per what normal population health improvement requires. So walk more. Don't be sedentary. All right. And lastly, engage or get the patient involved in the program whereby the patient is comfortable, has built a rapport with the team. I think that would be helpful.
Yeah, and also go with your elderly, family member to the program itself.
Yes, that's an
to
excellent
show
point.
The support, right, so that they are less fearful about doing the program. So if you're keen to find out, the article is out on the Straits Times. This is Advanced Cardiac Failure Patients Benefiting from Tan Tock Seng's rehab program. Well, thank you so much, Dr. Violet Hoon from Tan Tock Seng Hospital, for joining us here today.
Thank you.
Why start your day any other way? The Morning Drive.